All right, so now let's talk about communication disorders. Now, there's an idea we need to talk about normal communication, we need to talk about communication disorders, and communication differences. Normal communication has a tremendous amount of variability. A variability between for pitch, for loudness, for rate, for language, for speech, for all kinds of things. So there's a wide range of what's considered normal. And what's considered normal really is influenced by our culture or each individual culture. And culture is made up of language, geography, economics, religion, ethnicity, race, sexual identity, right? What's expected, the speech of a man, the voicing is going to be expected to be very different from the speech that we would expect from a woman, right? So all this is tied up into what's considered normal for males and females, for where you're from, for religion, for just all of this ties in together. So it makes it very difficult to even talk about normal communication because depending on where you are, that's going to be different. And a fairly new idea is the idea of neurotypical. So the idea that those who the average speakers, or also the average people of average intelligence, and just sort of the people that run society get to decide what normal is. And so this idea kind of started with autism, but it's branching out to, I think, all speech disorders as well, that just because someone's brain works differently than others, it doesn't mean there's something disordered or wrong about it. It just means it's not typical. It's not the typical way a brain functions, or it's not the typical way to speak or the typical way to use language, but it doesn't mean it's the wrong way to do any of those things. So then what is a communication disorder? It's a significant difficulty in one or more of the things that we've talked about already, right? In part one, formulation of language, transmission, reception, and comprehension. And it must adversely impact someone's abilities at school, at work, at home, socially, in their community. Because if it doesn't really make their life more difficult, then it's not a disorder. So we need to take that into effect too, that quality of life plays a big role here too. All right, so we're going to run really quickly through the disorders. Number one, we've got language disorders, and these can impact one or more of semantics, syntax, morphology, phonology, pragmatics. So if someone's not, typically presenting one or more of those for their age, their gender, their IQ level, right, it's going to be a disorder. And this includes kids, adults, reading, speaking, writing, signing, right, all the modalities that we can think of. Then we've got speech disorders, and there are different speech disorders. One is speech sound disorders, where you can have an articulation disorder where you just have a hard time making an R sound or a hard time making an S sound, right? Or you can have a phonological disorder where it's more of a rule-based disorder where you have difficulty putting endings on words. So you leave off the consonants at the ends of words, or you produce all the sounds in the front of your mouth and you don't produce the K's and the G's that are made in the back of your mouth. So you're fronting all the time. So phonology isn't difficulty with one in particular sound, it's a difficulty with a group of sound. There's also fluency disorders. So we'll have a chapter about stuttering and cluttering where the fluency, the rate, the rhythm, the disfluencies, discontinuities impact speech. voice disorders. We'll have a chapter on voice disorders where we talk about problems with the vocal folds impacting speech. And then also there's motor speech disorders, which the idea was that these were neurogenic speech disorders, but a lot of problems with phonology, a lot of stuttering and cluttering, and some voice disorders are also neurogenic speech disorders. But so we'll have a chapter on what classically we view as motor speech disorders. Hearing disorders, person can have sensorineural hearing loss, which is a difficulty with the inner ear or auditory nerve to receive and or process and move along the speech sound, or just sounds in general. You can have conductive hearing loss, where it's the outer or middle ear is unable to get that sound into the inner ear to be processed by the brain. People can also have mixed hearing loss, which is a sensorineural and conductive hearing loss. And then there's also auditory processing disorder, which is where people have difficulty processing speech sounds. So they can hear the speech sounds, but they have a hard time processing the meaningful information from the speech sound. And then we also have feeding and swallowing disorders. And these can be both young children and adults. So speech language pathologists were working in hospitals to work with people that had had strokes and had had traumatic brain injury, helping them with their speech and language. And a lot of these people also have a hard time with feeding and swallowing. And so a big part of speech pathologist jobs who work in hospitals is also working with the swallowing, and just the ability for people to eat is such an important factor. And we'll have a chapter on that as well in this class. And it's really important to remember that communication disorders can lead to social and emotional isolation. They can create serious personal, social, educational, and occupational difficulties for people. So that we're not just dealing with a disorder, we're dealing with a person, and we're dealing with how that person is dealing with their communication disorder and the impact of that disorder on the person's life. So again, we're not working with disorders, we're working with people who happen to have communication disorders. All right, we're going to finish up the chapter with careers in communication disorders. Our professional organization is ASHA, the American Speech Language Hearing Association. It's the professional organization for audiologists and speech language pathologists. Their website's asha.org. Check out asha.org during this course just to see, and I'll actually have an assignment where you do that, but just to see what's out there and what's on the web and what they're talking about. All right, speech language pathology is concerned with the study and understanding of human communication and swallowing, their disorders, and the assessment and treatment of those disorders. In order to become a certified speech language pathologist, you must have a master's degree from an accredited program like ours here at Appalachian State. You must pass the national certification exam, and you must do a clinical fellowship year. It's really just 9 months, but it's called a CFY, working under the supervision of a certified SLP. So you have a job, you're paid fully, but you have a certified speech pathologist who you have identified, who is there to mentor you for that first 9 months where you work. And once they sign off on your abilities, you are a true speech language pathologist, and you get your C's, your certificate of clinical competence. As of 2010, there are about 123,000 SLPs, and I'm sure that number has only grown in the last 6 years. Over 50% of SLPs work in the schools. The other 45% work in healthcare facilities, colleges, universities, private practice, rehab centers, lots of different places, doctor's offices, audiologists. The other profession we'll be talking about is concerned with the study and understanding of normal and disordered hearing and the rehabilitation of individuals with hearing impairments. In order to be a certified audiologist, you've got to get a doctoral degree, either an AUD, which is a 3-year degree, rather than for the SLP is a 2-year degree because it's a doctorate. A Ph.D. or a Sci.D. Is the entry-level degree for audiologists, just like SLPs. You've got to do a national exam, and you've got to have your CFY, your clinical fellowship year, under the supervision of a certified audiologist. There are about 13,000 practicing audiologists. About 70% of them work in a healthcare facility, hospitals, clinics, doctor's office, private practices connected with hospitals. So it's much more of a medical, not much more, but more of a medical profession. And then the other 30% work in the school system, industries, and colleges and universities. And that is the end of chapter 1. Yay.